Hello, thanks for stopping by. Things are about to get very clear. That is, this is a 2022 Medicare Advantage Clarity presentation. Going to be sharing information with you about all things Medicare. In particular, I'm going to talk about Medicare Advantage plans, show you some information about Medicare, a little bit about subs, and then spend some time showing you the differences between a few specific Advantage plans. My name is Tom Basie. Please consider me a resource. Reach out to me. Let me know if I can be of any assistance to you. I'm best reached via email, tom.basie@gmail.com. But I do have a phone number there available if you need. And that's the thing. Consider me a resource. I'll answer questions for you. I'll help you whenever I can on your Medicare journey. I'm licensed in several states, including Texas, Oklahoma, Florida, California, even New York. So here's the thing. Here's the agenda of what I'm going to talk about today. Understanding Medicare initially and some choices you have in the Medicare realm. We'll talk a little bit about eligibility for enrollment in Medicare. Talk about the advantages of Medicare Advantage plans. Included in that, we'll have a discussion about prescription drug coverage. And then per my remarks, I will show you some specific Advantage plans. I'll lay three of them side by side and kind of show you some differences that you will encounter for Advantage plans in your area. Wherever you are, they're going to be similar to this, maybe not the exact ones. We'll remark a little bit more about how I or another licensed agent can be of assistance to you. I do want to make some remarks about United Healthcare, and then I will show you some additional resources that are available to you. So here we go. Number one, step one, enroll in Original Medicare. That's the thing. This is a red, white, and blue card with someone's name on it, a Medicare ID number that has both numbers and letters in it, and then Part A and Part B effectivity dates. That's just an example. Approximately, an oversimplification is Part A is hospitalization. An oversimplification for Part B is some medical stuff that doesn't occur in the hospital, maybe doctor's visits, maybe testing, maybe even an outpatient surgery. If they cut a little skin off and not in the hospital, just at a doctor's office, that's an outpatient surgery. So Part A is hospitalization. Part B is outpatient. Once you have Medicare, you get those two things from the government. Now you have a couple things to consider. Option one, you can get a Medicare supplement to pay for deductibles and copays that Medicare doesn't cover. You can get a Medicare supplement. When you do that, you want to go ahead and add a drug plan as well, Part D as in drug, because Medicare supplements do not cover drug plans. So option one, this is one way to go. This is how everybody did it, really, that got it, that wanted more than original Medicare until around 2000. Medicare's been around since the mid-60s. The alternative is an Advantage plan. An Advantage plan works slightly differently than the Medicare supplement. We'll talk about that. And it has both Part A and Part B coverage in it, and it has drug coverage, and it has some additional benefits. This is the one the rest of my discussion is going to cover today. And I'm going to help you understand more about how an Advantage plan works. Okay, number one, to get in Medicare, typically you're 65 years old. More specifically, you are 65, you can get in if you on a special condition. For example, if you get disabled. Often people, if they're permanently disabled after 24 months, they can get on. But so as a general rule, it's for people who are 65, but there are some exceptions. And then in addition, it is typically for U.S. citizens, but you can get some if you've been legally resident here for 5 years. There's options for Medicare as well for permanent residents. So oversimplification, 65-year-old U.S. citizens. That's not quite accurate, but that's most of who is on Medicare. Okay, now when can you do this? There's an initial enrollment period. It's 7 months long. The month of when you turn 65, and actually 3 months after that, and 3 months before. So 7-month window, you can do that. You can join a Medicare, and you can get Medicare Part A and Part B. You can turn those on at that time. You can also join an Advantage plan at that time as well. Now, one thing I'm going to remark here, and I'll say it again because it's important, there's a penalty associated with not having some credible drug coverage. So if you join this, maybe you drop some employer coverage, you get on this, you want to make certain that you have some kind of drug coverage, or there'll be a penalty. If you don't have that, then you wait 5 years and you go to get drug coverage, there's a penalty. So be aware that it's important to get credible drug coverage right away. Here's a calendar look. For one thing, let's say you're enrolled in an Advantage plan. You can actually make a change between October 15th and December 7th. Every year, there's an opportunity annual enrollment period. If you like the plan you're on, you can leave it alone. You can stay on that plan. Typically, you're automatically enrolled in there. But if somehow you need to change, maybe a doctor doesn't take the Advantage plan you're on, or you get a new medication and there's a more cost-effective solution, you can make the change October 15th to December 7th every year. Actually, in addition, the first quarter of the year, you can make a one-time change there too, kind of plan to plan. So there's a couple times where potentially you can. This one is lesser known. It's more limited in scope, but suffice to say, Advantage plans, you can change them annually as need be. In addition to that, actually throughout the year, there are other times when you could change if, that is special enrollment period. Well, number one, anytime during the year, if you retire or lose employer coverage, well, there's an SEP, a special enrollment period. You could get on an Advantage plan then. Move. Actually, because plans are zip code and or location based, if you move, then there's a special enrollment period for that because you're going to, in your new area, you're going to get on a plan there. So there's an opportunity there. Qualify for extra help. Extra help is financial assistance from the federal government. If somehow you hit on economic hard times and you qualify for that, there's a special enrollment period there, so you can enroll in an Advantage plan. And then actually chronic health conditions, maybe heart disease, maybe diabetes. If you get certain chronic conditions, you get diagnosed, then at that diagnosis, there's a special enrollment period. So in addition to the previous standard times, this can happen anytime during the year if these events happen. Okay, so I'm going to talk about Advantage plans a bit more. Number one, these are some reasons. These are I consider these vital stats why you ought to consider at least Advantage plans. Number one, there's 27 million people that have an Advantage plan as of last year, 2021. So clearly a lot of people have them. Of those, there's 93% satisfaction rate. So to me, not only do a lot of people in the U.S. have them, they're actually statistically satisfied with them. So that's some compelling numbers, perhaps, on why you might consider it. And then here's another good one. 25% less spent than compared to original Medicare. So there's monies to be saved. So those are just three compelling stats I like to share on why you might consider an Advantage plan on your Medicare journey. Okay, comparing these side by side, an Advantage plan to just original Medicare. They both have these checks for hospital stays, some medical care like doctor visit and flu shots. This is basically Medicare in Part A. I remarked already this has it in there. Well, Part D is drug plan. That's not there. So an Advantage plan does cover that. Actually, in addition, it also has some vision benefits, some hearing benefits potentially, and then actually there's no out-of-pocket maximum on original Medicare. In theory, if you're having significant health issues and you keep going, for example, Part B, the outpatient stuff, there's a 20% copay. Potentially that'll just keep adding up. An Advantage plan has an out-of-pocket maximum, so at least it'll cap your annual health care cost. So those are some nice, compelling reasons compared to original Medicare where you ought to consider an Advantage plan as well. Okay, this is not necessarily in order, but these are top 10 advantages, and I like to go through them. I've maybe remarked about a couple of these, but it merits saying it a second time. Number one, something to be aware of. I talked about Part A and Part B. Part A is typically already paid for over 40 quarters while you're working. Once you sign up in Medicare, typically you're paying a premium for Medicare. For most people this year, 2022, it's $170. But my point is you must continue to pay that Part B premium. If you sign up for a Medicare Advantage plan and it costs $0 a month, and many of them do, that's fine. That's all it's going to cost you to that carrier. But you do need to continue to pay your Part B premium. Medicare Advantage has you covered as kind of an allusion to that previous side, how it's got the Medicare stuff in it. And in addition, it's got the additional benefits. Joining a Medicare Advantage plan may affect your current coverage. Typically, you're not doing that concurrently. So, for example, if you're working, you're potentially going to drop that coverage and get on the Advantage plan instead. It's best to use network providers. We almost never use the word BEST in the Medicare realm, but we will say it here. That's because it's never going to cost you more to use network rather than out of network. Some plans offer you the opportunity to go to out of network doctors, but it'll be a higher copay, for example. So when we say it's best, is it's going to cost less to go to in-network doctors. And then you might qualify for financial assistance. That's the thing. If you're Medicare age, there are different ways that can be investigated often at the state level, and an agent can help you. For example, Medicaid. Medicaid is a program that is offered that is administered at the state level, and then some financial assistance, and or at the federal level, there's some as well. So it's something to be aware of and think about. I mentioned this once, but I want to mention it again. If you enroll in Part D, which is think drugs, late, you may pay a penalty. I'm a proponent of as soon as you start Medicare, whether it's option 1 or option 2, make sure you have some drug coverage to avoid that penalty. A Medicare supplement insurance plan is not a Medicare Advantage plan. That's my slide where I show option 1 versus option 2. They're different, and we're talking about Advantage plans today. We're really not talking more about Medicare supplement. Keep your member ID card handy. I showed the red, white, and blue Medicare card. Actually, if you get on a Medicare Advantage plan, you can leave that Medicare blue card at home or in a safe place, and you can carry your Advantage plan around to the doctors, maybe dentist if you got dental benefits on your plan, vision if you're going to the ophthalmologist, if you're going to get a hearing test, if you're going to the pharmacy, it's that card, you carry that around. In other words, it has all your benefits covered on that single card. Medicare Advantage plans offers the same protections as the original Medicare. That Part A and Part B is included in the Advantage plan. And then you have a built-in financial safety net. That's reiterating the out-of-pocket maximum. A Medicare Advantage plan has an out-of-pocket maximum. Maybe it's $4,000 for an HMO. Maybe it's $10,000 for a PPO, but whatever it is, there's an out-of-pocket maximum. That way, you know, if you have a big, terrible health event, and you have an extended stay in the hospital, you're not going to exceed that out-of-pocket maximum. Once that's paid, you don't pay anymore. So that's good to have. Okay, I'm going to talk a little bit about drug coverage at this time. Many people don't understand this. This is dictated by the federal government, and all drug plans adhere to this. There are 4 phases or stages to a plan. There's the deductible stage, the initial coverage stage, the coverage gap, also known as a donut hole, and then the catastrophic stage. And depending on how much the cost of the medications are, people can move through one or all 4 of these during the given year. So I'm going to make up an example just to make the math easy. If I've got either a single medication or a bunch of medications and their retail cost is $1,000, maybe I've got a copay of only $100. Well, then, for example, let's say I have no deductible. If there's no deductible on plan, then I move into initial coverage phase. For the first 4 months, I will pay my $100 copay, and the cost of meds are $1,000, so that the plan will pay $900 of that. January, February, March, April, and then into May. Once I've gotten to May, my total drug costs, remember they cost over $1,000, so they exceeded here. Now I'm in the coverage gap. So then June, July, and June, July, and then I have to go to August. Once I'm in August, then I'll get out of that. But while I'm in for those 3 months after I've the part of the initial coverage pay, now instead of just the $100 copay, I have to pay 25% of my drugs. So I picked $1,000. It's easy for me to calculate. It's $250. So nothing changed. My pharmacy didn't change, but I was paying $100 copay for a while. Once the cost of my medications, not my copay, exceeded that number, then I paid 25% for $250. Now, by September, I've already exceeded this, and I'm in the catastrophic phase. In catastrophic, you pay either $9.85 for drugs or 5%, whichever is greater. When it's going to be greater than that, it's $50. So in that example that I made, I was in this phase January through April, and then May, June, July, I was in the coverage gap, and then the rest of the year, August, September, October, November, December, I was in this one. So I paid $100 a month here, $250 for those months, and then $50. So that's how this works. If some people have only a couple generic drugs and they cost either $0 on the plan or $4 a plan, they'll just stay in this initial coverage phase. They never move along, and they'll just continue paying that $4 for each medication for the duration of the year. So some people move in. You have a real expensive drug. You got $5,000 drugs. Some people have that. You move to catastrophic right away. So by month 2 or 3, you're already in here, and you pay 5% of the cost. So 5% of $5,000 drug would be $250. So they'd be paying $250 for the rest of the year. So depending on the cost of your medication, you move through these phases. That's how prescription drug coverage works in the Medicare world. A couple of things I want to remark to reiterate: that's the total drug cost is what determined that, not my out-of-pocket. The out-of-pocket is what I'm paying, and so that's any of the co-pays that I make if there's a deductible phase. So there's a distinction to understand, and that it has implications on how you go through the phases. And then there's a reminder: there is potentially some extra help, so you can apply for that and get additional financial assistance with cost of meds sometimes. Okay. Prescription drug coverage. There's a pharmacy network for United Healthcare. They have over 65,000 pharmacies in their network. And what happens is things cost less in network. We already made that remark. And there's actually money to be saved in mail order as well. So my message is, if you use to get a United Healthcare plan, there's tons of it's likely a pharmacy near you is in network. You can save if you're in network. And guess what? Even if somehow there's not, you can actually save significantly by using a mail order service. And it's convenient as well. The drug list that each plan covers is called the formulary. Not every plan covers every drug in the world, so they've got a list on what they cover. And when they do, they divide up the plans into 5 tiers. Tier 1 is preferred generic drugs. Tier 2 is generic drugs. Tier 3 is preferred brand name drugs. Tier 4 is non-preferred drugs, and Tier 5 is specialty drugs. I suspect you might guess the higher the number of the tier, the more expensive the drugs are, and the more expensive the copay. But all drugs that a plan covers are on the formulary, and they're tiered that way, so one can determine what the cost of the drugs are going to be during the year. A couple other vocabulary one might understand when talking drug coverage. Step therapy is when you try a lower cost solution to treat something, and then you can step up later if that one's not functional. are not getting the desired result. Quantity limits, there may be only a certain amount of drug that are allowed to be made available, and that's to ensure that the drugs are not abused or safe use of it. So quantity limits mean how much you can get over a given period of time. And then prior authorization, sometimes the doctor may need to provide information before you can get a prescription. So prior authorization, step therapy, and quantity limits are something you might hear in the Medicare world. When it comes to prescriptions, you can't ask for an exception. If the drug plan isn't on the drug formulary, you can reach out and say, hey, can you get an exception? And that's a possibility. You can also ask to get some restriction waivers. Somehow your doctor said you need 60 pills a month and it only allows 30, then you can ask that. So those are examples of how you can ask for an exception. And if you do, generally you're going to find out within 72 hours if a doctor submitted that request. And it can be expedited, for example, if it's a medical emergency. So those are exceptions. But as a general, you need to have a drug. If you need a drug, you want it to be on the formulary. Okay, now what I'm going to do is I'm going to compare 3 plans side by side. I've got them laid out in columns here, and we can kind of look. They're all 3 Advantage plans. They're all from United Healthcare. These 3 happen to be in the North Texas area, but there's similar plans to you wherever you are in the U.S. So here we go. This is how they look. This plan is called Plan 1. This plan is called Plan 2, and this one's just called Medicare Advantage. 3 plans. The 2 blue plans outside are quite similar in certain ways. In fact, I might argue that this plan out here is actually just a newer version of this plan, but we'll see how they're different. Just kind of look at them. So they're very similar. This plan actually, I guess they're all 3 similar, but the thing is, Plan 1 was an original Advantage plan here in the Dallas-Fort Worth area. This Plan 2, you pay a premium. Plan 1 is a $0 premium, doesn't cost additional money, it's beyond your Part B premium. This one you pay some more, but what happens is then you'll have lower co-pays and more benefits on the plan you pay for. This plan, the Advantage plan, it's simply similar to the $0 plan, but there are a couple of pros and cons, one versus the other. And so in this area, you get the choice. You can get any of these 3 plans as an HMO in your area, and we're going to look at the difference. So in the middle plan, it's a $0 monthly, a $73 monthly premium. For the 2 blue plans, they're a $0 premium per month. All 3 of these have a $0 medical deductible. All 3 of these have a $0 copay for primary care visit. For a specialist visit, actually, the 2 plans here only cost $20. The original plan in the area actually has $30. So you can get a reduced specialist visit pricing by either going with either of these Plan 2 or the new plan. Preventative services, $0 on all 3 of these. Now, notice the difference here on the cost of a hospital stay on these 3 plans. They look quite similar overall. Plan 1, there's a $250 copay for the first 5 days in the hospital. After that, it drops to 0. For Plan 2, where you're paying $79, well, it's just a $150 copay. That's it. It's all it's going to cost. So it costs significantly less the first few days on Plan 2 versus Plan 1. On the new Advantage plan, it's actually $325 a day for the copay. So of the 3, this is the most expensive hospital stay if you're going to go to the hospital this year. Maybe you're not planning to, but it's good to know this. Skilled nursing facility pricing is the same for all these plans. It's a $188 copay for the first 20 days. Then it drops to 0 after that. Outpatient surgery, this is not a range. It's either 0 or it costs a maximum. So the maximum outpatient surgery is $225 on Plan 1. It's only $150 on Plan 2, where you're paying that premium. And then on the new version plan, it's $275. It costs some more. So far you're thinking, well, if I don't want to pay the premium, why would I go with this one? We'll see a little bit later on. There's just different benefits one versus the other. But right now, this plan is the $0 premium, but this plan is also $0 premium, but it costs us for hospital stay. Just important to be aware of the differences. I'm not going to read this whole chart, but this is basically the cost of the medication. Actually, the cost of medication on all 3 of these plans is quite close. There's almost no difference between them. I found one in here. Let's see. I found one. Where was it? Here. Well, there's subtle differences. So for Tier 2 drugs, there's still a $14 copay on Plan 1. For this new version, $0 premium, it's actually only a $0 copay, or at least on a 100-day range, the same as the Plan 2. But as a general, the medication isn't very much on these plans. The differences are the cost of care. Let's see. So here's some above and beyond Medicare benefits: dental and vision and hearing over counter. Let's compare these. Number one, on the dental coverage, the first 2 plans are only $1,000. So this plan that costs more to stay in the hospital, even though it's $0, it actually has $500 more dental benefit than the original Plan 1. So if you want a $0 plan in this market, and you want more dental coverage, maybe you pick this one, but with the recognition that a hospital stay will cost more if you went to the hospital that year. Routine vision care, all three of these have a $0 copay, and the two $0 premium plans have $100 towards eyewear. Actually, for the plan where you're paying a monthly premium, there's actually $200, so it's double the amount of eyewear benefit on that. They have the same. No, that's not quite true. For hearing aids, there's copays as little as $175 for these first two plans. Actually, it's $375 is the minimum copay for the plan that has the more dental. Over-the-counter benefit. Every 3 months, this plan gives you an over-the-counter benefit, so you can order from your home and get Band-Aids, aspirin, things that are not prescription that you might get from a pharmacy. There's a catalog, so it's nice that you get a credit you can order from that. It's actually a little bit more on this new plan. You get $45 a quarter. All three of these plans have Renew Active. Renew Active is a lifestyle health fitness organization. What some of the people think of as a gym membership. So it does potentially include a gym membership. So it's likely you can get a $0 cost per month membership at one or more gyms near your area. But it's more than that too. There's some videos available. There's lifestyle coaching. So it's a nice benefit that all three of these plans offer. And then virtual medical visits. All three of these plans have $0. So I think now that we've gone through this, the takeaway is there's 3 different plans in this area. They're all from the same carrier. You can pay a monthly premium and increase your benefits like eyewear, for example, or you can lower your copays like the cost of a hospital stay. And even between two plans that are both $0, there's likely more than one $0 plan available. There are differences between them. You take a look at them, see how much dental coverage they have, see what their hearing aid benefit is. I think this is a nice illustration of how that works. Here's a little bit more here. So actually, post-hospital meal benefit, one of these plans does have that. So that's pretty nice. So if there's somebody that either doesn't have somebody at home to cook for them, for example, or there are challenges at home, you can get up to 28 meals for 14 days delivered after a hospital stay. So as long as it's inpatient, these other two plans don't have it. So that's a nice benefit that's there. All three of these do have a nurse hotline. Okay, just so happens that these plans are offered in a series of counties all around the Dallas-Fort Worth area. Wherever you live in the country, I suspect there's similar plans to one or more of these where you live. And there's some PPO plans as well. All three of these plans are HMO plans, which means you need to go in network. There are some plans that will allow you to go out of network. But if you go that, for example, the out-of-pocket max is often higher. On all three of these plans, I don't think I even mentioned that. Two of the plans, it's $3,900. On the plan where you're paying the money, though, monthly, it's only $3,200 the out-of-pocket max. So you lower your out-of-pocket max by paying that premium as well. Okay. For me personally, please do consider reaching out to me if I can be of any service to you. I'll look up doctors and hospitals for you, check if they're in network. I can check your prescription medication and let you see how much the pricing is going to be on those. I can help you find additional services. Like I mentioned, I'll help you find the closest health club that takes the Renew Active membership. I can help you check, for example, your eligibility for Medicaid. Actually, TRICARE, there's a series of plans. These weren't one of them, but there are a series of plans, Advantage plans that actually play well with TRICARE for life. If someone's a veteran and they've got that, they can actually get an Advantage plan that will play with that and get some of these benefits, like a membership at a local gym or ability to go see a dentist nearby them. A little bit about United Healthcare. They've got over 40 years experience, almost as long as Medicare's been around working on it. More people choose United Healthcare than the other one. So there's an endorsement by the population. And then I've had the pleasure to work with a lot of people. They have a huge network and they are committed to helping someone live a healthier and happier life. So I endorse that carrier. Having said that, I can also help you get some additional resources. Medicare Made Clear is a kind of a description of the first portion of this. It's a hard copy or electronic book that tells you about Medicare. You can dial 1-800-MEDICARE if you want to talk to a human being that's a part of the government organization that administers it. Medicare and You is a big booklet that as you're turning 65, the federal government sends that to you so you can get a hold of that. There are online plan finders. For your area, there may be 15, 20, 30. If you're a big metropolitan area, even more plans. I can help you find those, and we can take a look at shop plans that are available near you. State resources. Each state, for example, on Medicaid, you can apply online often, but if you need Medicaid resources, I can help you find that. Social Security information is also available. If you picked a plan that had a premium, but two of the three I showed you were $0. If you picked the one with $79, when you sign up for Medicare, you could actually turn on Social Security as well, and you could say, take that $79 out of my Social Security. So that's one way to fund any Medicare plans you opt to do. And then administration and elder care, I can help you find resources and find like places to stay, or for example, home health. A lot of these plans offer home health. If somebody needs to come in and change a wound for you or a catheter or something, often that's covered in their plan. I can help you find the home health resources. So to reiterate, this is me, Tom Basie. You've got my email address, tom.basie@gmail.com. Please do reach out to me if I can be of any further assistance to you. Thanks for stopping in. You have a good rest of your day.